It is now my pleasure to introduce to you Professor Guohua Song, who I've had the pleasure to meet while in China. I've been very impressed by her academic research and publications, her hard, strong effort. Some of her papers are the earliest ones that I came across, actually. Some excellent clinical trials and mechanistic research. It's very impressive, and I'm grateful for our conversations, and all the support that she gives, and her dedication to this field of molecular hydrogen research, and her support with this H2MHI summit. Now I'll read to you her bio. Professor Guohua Song received her Ph.D. of Medical Sciences from Yonsei University, South Korea. Her research focuses on lipid lipoprotein metabolism and the application of molecular hydrogen, an emerging antioxidative gas. Her work has been supported by the National Science Foundation of China for 4 times, and also by the Science Foundation of Shandong Province for 2 times. She has published more than 40 scientific peer-reviewed papers, including in Atherosclerosis, Thrombosis, and Vascular Biology, the American Journal of Clinical Nutrition, Journal of Clinical Endocrinology, Metabolism, Free Radical Biology, Medical Journal of Lipid Research, BBA Molecular Cell Biology, and Atherosclerosis. Besides, she was appointed as a member of the Standing Committee of Molecular Hydrogen Biomedicine, member of the Young Scholar Committee of Biomedical and Molecular Pharmacology, members of the Specialist Expert Committee of Molecular Hydrogen Biomedical Special Fund for Development. In addition, she was awarded the Science and Technology Award for Young Talents by Shandong Province, and she is one of the main candidates to receive the award of the Science and Technology Progress in Shandong Province. In recent years, she was invited to attend the academic conference at home and abroad, and provide the oral presentations as the invited speaker for many times. Now, please welcome Professor Song.
Hello, everybody. The title of my presentation is Hydrogen Intake Relieves Alcohol Consumption and Hangover Symptoms in Healthy Individuals, a randomized and placebo-controlled crossover study. Alcohol-induced hangover represents a significant, yet unstudied, global hazard and a large social-economic burden. The aim of this study was to investigate the effects of hydrogen on relieving drinking and hangover symptoms in 20 healthy volunteers. In this pilot, randomized, double-blinded, placebo-controlled, matched crossover interventional trial, participants were matched into pairs and randomly assigned. Study Group 1 inhaled placebo air for 1 hour, followed by drinking 100 ml of liquor, 40% alcohol, within 10 minutes, and then pure water. Study Group 2 inhaled a mixture of hydrogen and oxygen gas for 1 hour, followed by drinking 100 ml of liquor within 10 minutes, and then hydrogen dissolved in water. On a second intervention day, the crossover, more than 1 week later, study group subjects were switched to the opposite order. Breath alcohol concentration, that is BRAC, hangover severity, and cognitive scores were measured. Out of the 25 volunteers, 20 completed the trial and underwent the per-protocol analysis. In this figure A, the breath alcohol concentrations were significantly lower within the hydrogen group than within the placebo group at 30 minutes, 60 minutes, and 90 minutes after alcohol consumption, both on study day 1 and study day 2. In figure B, the differences between the 2 stages, study day 1 and study day 2, were also compared, which further confirmed the alcohol-lowering effects of hydrogen compared with placebo group. The comparison of intra-individual BRAC difference X in study group 1 and difference Y in study group 2 was not statistically significantly different. This was shown in figure C, suggesting the use of hydrogen first or later, that is, the order of treatment, has no effect on the result. Although alcohol-lowering effects of hydrogen were obvious, female participants showed an increased BRAC compared with males. To confirm whether hydrogen treatment has different effects on males and females, we performed a further cluster analysis. As shown in this figure A, BRACs were significantly lower in the hydrogen group compared with the placebo group in male participants on both intervention days of all participants. However, there were no differences between the two groups in female individuals, although BRAC has a trend to be decreased in hydrogen group. This data suggested the alcohol-lowering effect of hydrogen was obvious in males, but not in females. The severity of hangover symptoms within the placebo and hydrogen group during the study is summarized in this table. Regarding the 15 hangover symptoms, the hydrogen group reported having fewer headaches and less sweating than usual compared with the placebo group. Hydrogen did not significantly improve the other 13 symptoms. Overall, the sum of hangover symptoms for the hydrogen group was significantly lower than that for the placebo group. We further analyzed the effects of hydrogen on the severity of hangover symptoms in males and females respectively. As shown in this table, hydrogen treatment improved the symptoms of headaches and excessive sweating in males. Further, in females, hydrogen also showed to improve headaches and excessive sweating. Besides the above self-described symptoms, we also performed computerized psychological assessments 3 hours after alcohol consumption by using the Wiener test system. As shown in this figure, the relative scores of divided attention, response inhibition, processing speed, and cognitive flexibility were significantly decreased by hydrogen treatment after consumption of alcohol, indicating that hydrogen could improve the attention and executive functions after drinking alcohol. One of the secondary study endpoints was the evaluation of factors associated with BRAC and hangover symptoms. We performed multivariate linear regression analysis and ordinal logistic regression analysis for 2 target variables, BRAC 90-minute and severity of hangover symptoms, including all participants for study day 1 and day 2. As shown in this figure, the consumption of hydrogen was negatively and female sex was positively correlated with increased BRAC. Likewise, consumption of hydrogen was negatively and female sex was positively correlated with increased risk of hangovers. Conclusions. We confirmed that treatment with hydrogen significantly reduced breath alcohol levels and improved attention and executive functions after alcohol consumption in the short term, and it relieved a variety of hangover symptoms in the long term. Our results suggest that hydrogen might offer a bit of relief for individuals who are suffering from the effects of alcohol consumption. That's all. Thank you.